This is how you cross over from Israel to Gaza, and right now we're in no man's land. Prime Minister, do you now regret when once asked what your favourite joke was, you replied, Nick Clegg? And Deputy Prime Minister, what do you think of that?
Mr. Trump, why should you be president? What makes you fit for the role? Is it just one big ego trip?
Thank you very much.
People aren't sure they can trust what you say. You say things and then it turns out that they're not quite what you said. My name's Andy Bell and I've been a journalist for over 30 years. In this podcast, How Did We Get Here?, I aim to provide background and context to a big story in the news. This week, we are talking about coronavirus, but specifically one aspect of the fight against it, testing and contact tracing. Is this the key to escaping the lockdown? How can it work? And how is Britain doing compared to others? I've been talking to Eivor Oborn, a professor of health technology at Warwick Business School. If you feel like you've heard a lot about Bluetooth apps, NHS X and track and trace, this is the edition for you. Eivor Oborn, thanks very much for talking to us for this edition of How Did We Get Here? So let's go straight into it. Testing. We've been hearing a lot about testing recently. What is the purpose of testing in terms of the people in charge being able to get a handle on the disease?
Well, testing is important for the people in charge, as you say, to understand who has the disease, because people who have the disease are spreading it very quickly. So on average, everyone who has the disease is spreading it to about 3 others. So if one person has the disease, 30 days later, over 400 people will have the disease. It spreads incredibly quickly. So we need to know who has the disease so that we can isolate those people. So the whole point in testing is to find out if we have the disease or not. If we don't have the disease, then we don't really want to be isolated either. So if I am clear, I want to be able to go to work or walk around in the community. But if I am not clear, so if I've been tested, then I have a level of assurance as to whether or not I'm putting others at risk because I might have the virus and then pass it on, or I can know I don't have the virus and therefore I can go in good conscience and realize that I'm not going to infect other people. Because the transmission rate is so high and because much of the transmission happens before we have symptoms. And I think that is also very important, because if we don't even know that we have the disease, then waiting for symptoms before we go and get tested, this is part of the problem as to why the whole disease went out of sort of a viral spin, if you will, is because it was being passed on so quickly and the people passing it on didn't realize they were doing it.
Okay, so if we go back to the start of all this, we were testing initially, and then there seemed to come a moment when the announcement was, well, it's here now, and there's not much point in testing anymore. That's my memory. Is that about right in terms of what happened in the UK?
I do think it was something like that. The problem is that the testing was done at a very low scale level because it wasn't set up. The country hasn't been set up. The systems for the labs, the testing spaces, the testing people being able to process, it takes a lot of infrastructure to conduct these tests. So a level of testing that was possible was only able to contain the actual spread when there were very few cases. But as soon as we had too many cases, then it was impossible to keep on top of it. And so then they essentially stopped and started to use the tests instead to confirm diagnoses.
And what about tracing? Where does tracing fit into this puzzle?
Well, tracing is important because if I find out tomorrow that I actually have the virus, then anybody I've been in contact with for the past 5 days is also at risk of having the virus, and they may not know that. And if we can trace all the people that somebody who has been given a positive diagnosis, who have they been in touch with? Have they been in contact with somebody who isn't yet aware? The tracing is taking care of that aspect of the disease spread so that the person who's isolated can isolate and not spread it any further, but they might have already infected 3 other people. We need to find those 3 people, and that's through tracing. And that can be done electronically or manually.
Okay, well, we'll come back to that, but I just want to go back again to the beginning of this, because again, at the start, there was a sense that people were being tested and their contacts were being traced. Did we just sort of decide it was just on such a scale very quickly that we just couldn't do it?
Essentially, yes. I believe that would be the most accurate representation. It's just too many people to try to maintain a manual tracing process. It takes a long time to come up with all the contacts, and by the time they come up with those contacts, they've already infected 3 or 4 other people. And so the exponential growth is such that you cannot stay on top of the contact, sort of seeking out these contacts, and so then it becomes a bit more of a nonsense.
Okay, now you mentioned about tracing electronically. This is presumably the telephone app. Tell us more about the principle of using that.
Well, there are a number of different apps out there, and I believe it's over 20 countries who are looking into using the app. So the app that is being developed by the NHS and with other sort of technologists, the particular technology that it uses is to use Bluetooth sort of connectivity between 2 phones. So it's important to note that it's not using GPS, which actually follows you across all of your movements in time and space. So if it were the GPS kind of a contact tracing, you would actually follow that I'm going from here to another place and back again. You could see the trace. But the Bluetooth, what it does is that if you download the app, it emits a low signal to another phone that also has the app. And so if you happen to be in the store and standing in the queue, and the person behind you also has this same app, it will send a little message to my phone to show that we have been in close proximity. And if this data is stored on the phone, and if then that person in the queue finds out that they are testing positive, I would essentially get a message that I have been in close proximity with somebody who had tested positive. I wouldn't know who, and I wouldn't know where necessarily unless that data is also released. But it's not clear that data needs to be released.
Okay, has anyone made this technology work yet?
There are a number of places where the technology is in use, but there are always some issues that are popping up with the use. For example, the Bluetooth technology not working well on certain handheld devices. So the phones that people use are a varying level of technological sort of advanced state that it can actually make the app work well. And so some of the challenge technologically is with which phones does it work well on and which ones does it not work well on. So to answer your question, I would say yes, it's working, but we haven't yet seen examples of it working well across a whole population because we haven't had the uptake. Countries are trying to put these technologies into place, and we've actually here had the benefit of seeing what some of the problems were in Singapore and in other countries, Korea, that have been using technologies. And I think that what the UK is doing is trying to learn from some of those issues and then build their technology around it.
We'll come on to the building of the app here in a moment, but I thought that, for instance, South Korea had done, or Singapore had done a pretty good job on using this app. Is that not quite the case?
Well, it wasn't the case because in the Singapore situation, as I understood it, the app would go to sleep if your phone wasn't awake. So when you carry your phone in your bag and you're walking around and haven't looked at it for a while, the phone, essentially the apps go to sleep to draw less battery life. And so the app then sits in the background. And so when the app is in the background, it wasn't emitting enough of a Bluetooth signal to actually be able to catch the other phones that might be nearby. And if the phone was actually trying to emit a signal, users were finding that they couldn't use their phone properly. So if I might have a telephone call coming in, but I can't open that call and receive it because my Bluetooth is acting up because it's trying to connect to another phone. So because of that, the users were not happy with the app, and very few percentage of the population then used it, in which case the overall effect is much lower. So what the current task technically is, how do we get the Bluetooth working in the background and not interrupting regular phone use? Because we still need our phones.
Interesting. And do we have an idea of the percentage of the population that has to download this app to make it a useful tool in combating the infection?
We have good estimations. I would call them best guesses because we're projecting based on algorithms. So again, we're not entirely clear, but the estimate is that around 80% of smartphone users need to download the app, and I understand that is around 60% of the UK population. So a large portion of the UK don't have these phones, and so they're already being calculated in as non-users.
So it's not a magic bullet in many ways, this app, because we hear a lot about the idea of the app technology being a part of the solution, but it doesn't solve the whole problem, does it?
No, it certainly won't solve the whole problem. No, I think we have the coronavirus with us to stay for a while, and we need to figure out a number of different techniques to help us manage around it. And this is just one. And if it doesn't work right initially, I think that the app will need to be reworked. And that is one of the reasons why they've developed it the way that they have, so that they can keep changing the technological foundation, if you will, so that it is working better.
Okay, let's talk about the UK experience. I mean, the NHS is basically developing the app here. Does that fill you with confidence? Because, to be fair, the NHS is good at a lot of things, but there have been some pretty bad examples in recent history of the NHS and trying to roll out technology.
Yes, that's an interesting insight. In fairness to the NHS, one of the things that hasn't escaped me is that in the last month, the uptake of technology use, for example, in general practice, has gone from perhaps 5% to 80%. So we have seen a dramatic tsunami change in the way that the NHS is able to engage with a lot of technologies. So that's interesting. The NHS X is a new branch of the NHS, as I understand. I'm not that familiar with when it was set up, so that's not really something I could say for sure. But this is actually a technical arm that has been developed within the NHS remit, if you will, in order to help the NHS become more technologically savvy and advanced and better at doing this kind of thing. Because the NHS, if it can be involved in the technology from within, then it should have a better understanding of how their own system works. If external developers make it and aren't familiar with how the NHS works, then there could be less ability for the different technologies to interface well. So I think that's one of the logics behind having the NHS involved. But it isn't just the NHS. They are working with developers at various engineering and computer science research labs as well. So they do have technical expertise to do this job, I believe.
Okay, I mean, would it be better just to hand this over to the people who know how to make apps and mobile phones and say, you develop this for us and we'll buy it off you?
This is an approach that many countries are using, and it's hard for me to say which one would have been better. I do think that the large tech firms will bring up a device or an app that will work well on their phone. The problem is that if you let the tech firms control the app development, then they will likely also control the data. And I think that the NHS are also a bit leery of letting all that data be given to the tech firm unless the server component of it, because they've elected to have a server component, is somehow separated from the whole app. But the way that the technology is being put together, a key issue with the use and the acceptability is who is owning the data and who gets to store the data and what's being done with the data. And if the NHS keep that somewhat in-house, then as a system, it has more say over that.
I mean, this is a bit of a trade-off, isn't it? And it is a trade-off between maybe getting the most effective technology as quickly as possible into the country to combat this disease, versus you could be forcing people to hand over a whole bunch of information that they don't want to hand over to other people, and they don't know how it'll be used in the end.
Yes, that's right. It is a trade-off, and the trade-off is a difficult one to square. But I think that that is one of the reasons why different countries are trying to do this in different ways, because it's a political decision about what is legitimate to ask people to give up at a time of a crisis like this, and what will people feel is a safe way, and do we give it to the government of our country or do we give it to the tech firms?
I mean, do you think you might have to make it mandatory for people to download this app in the same way that maybe you move towards a system where organ donation, you assume that people have accepted organ donation without, unless they say different? Do you move to a situation where you basically say, sorry, you have to download this app unless you're going to make a conscious decision not to get involved in it?
I doubt that will happen in the UK. I certainly don't. It certainly won't start there. That would be too much of a breach in civil liberty. And even if they forced me to download the app on my phone, I could just leave my phone at home and go off into town. So unless you have a system where you're calling people up to make sure they don't leave their phone at home, which some countries have done, but downloading the app per se, there's too many workarounds as to then how you use your phone. Some people have more than one devices. So people have to want to buy into the whole tracking and tracing in an electronic way, I believe, in order for this to work in a society that is open and democratic.
Okay. Now, beyond the apps, Matt Hancock, the Health Secretary, also talks about recruiting, I think, 18,000 people, on the ground, going around, being a part of contact tracing. Do you know how that would be supposed to work?
The contact tracing is, as we discussed earlier, is such an important part of trying to keep on top of the disease. And even if we have this app in place, and let's say it's catching some of the contacts that I might have if I'm going in the community, we already know that there are a large portion of people who won't be able, for different reasons, to use an app on a smartphone. And so there's still a lot of work to be done for people who find out that they have a viral diagnosis or that they have COVID-19. Somebody needs to do the work of contacting all the people they might have been in contact with. Some of those, so a proportion of the work can be done electronically, but there is still going to be a significant proportion of work that has to be done manually. So it's going to be a both and. Some of it, let's say 40 or 50% of the contacts, will find out immediately through an alert in their app, but there will also be those that will need the actual phone calls, the manual tracing. And so that's, I think, an important part of what those 18,000 will do. I think another key role for those individuals is to help people who are self-isolating, who have recently received a diagnosis of having the virus, help them know what to do and keep on top of, are they okay? Maybe call them up, find out if they have worsening of symptoms, or if they need some more diagnostic kit or that kind of thing. So there is a lot of care that then might need to follow for those who are self-isolating that isn't necessarily in the purview of the NHS to look after. So this recruitment army of people could certainly help with that.
I mean, taking into account both the technological side of it and maybe the boots on the ground side of it, who would you point to around the world who you think has done the best job of contact tracing?
the ones that are very, very highly reliable, for example, South Korea, they're also very intrusive. So it depends on how much the contact tracing, in a sense, is a way for me to be monitored and looking at how I'm being monitored. So, for example, if the system is very successful, then really to contact trace me, I have to look at where I spent all my credit cards, where my phone GPS signals have been. So, if somebody was going to trace me, they need to sort of surveil where I've been. And it really depends on what access you have to that information. So it depends on what you mean by success.
Well, let me put it this way. Success purely in terms of fighting the outbreak.
Yeah, I would have thought that some of the Asian countries have been very successful in fighting the outbreak, but at a very high price to civil liberties. I think Germany has been a good example of effective contact tracing. Early on, they've been testing, at least to the extent that they've been able to put the boots on the ground and track people. That I'm not sure about. So I'm not sure that we have an example of a country that is doing this well in a way that I believe also doesn't affront people's civil liberties.
Final question. I mean, how important is this whole process for just getting out of this problem? Can you emerge from the situation that coronavirus has put us in without effective testing and tracing?
I think it's difficult to emerge from this without some mechanism that is electronically enabled to help with the contacting process because of the rapid spread of the virus. So we have the alternative of staying in lockdown or moving around society, but having quicker notification if we've been exposed to the virus, to keep the virus sort of growth under that number one that is often talked about, the R naught, the number. So I think it's important.
The reproduction rate of the virus.
Yes, the reproduction rate of the virus. This is an important way that we think we can keep it down. Obviously, this is an experiment because this is a new situation. The world has never faced this problem, and we've never used this app, and we've never tracked people in this way. So it is, in a sense, a live experiment. So from that point of view, it's the space to watch. But it's a very good educated guess, and I think it also presents a lot of sort of sensible possibilities for this to be successful, and therefore it's definitely worth a try.
Eivor Oborn, thank you very much for talking to us for this edition of How Did We Get Here? Very, very interesting. We'll see how this all plays out, and hopefully we can emerge from what we're going through right now and into something that looks a little bit more like the old normality. But thank you very much.
Thank you, Andy, and it's been a pleasure speaking with you. Thanks for the opportunity.
Thank you, and stay well. Professor Eivor Oborn. If you have any comments on this or ideas for any other podcasts, you can email me on andy.bell@itn.co.uk, and I'm tweeting at AndyBell5News. I hope you've enjoyed this edition of How Did We Get Here? You can find previous editions on coronavirus and on other subjects if you subscribed, and there'll be another edition along soon. For now, thank you for listening and stay safe.